there's lots of differences in terms of how medicine is practiced. It's not actually the tools of medicine that's different, it's the way it's practiced that needs to be culturally appropriate. For some people, coming to hospital is a big thing, and so, instead of that, doctors do go out to the marae or the community houses and have their clinics there, because that is more acceptable for some folks. It's also sometimes a collective culture, and I identify with that. Coming from a Salvation background, we tend to be collective in our decision making as well, which is great if you fit in, as I said, but if you don't, it's a problem. And so, the way we make decisions can be different, because it needs the guidance of the elders around you, as opposed to a very individualistic, yes, I consent to this and yes, I don't. These are all things that have always been issues that I've always thought about. And in the department, we've been trying to move into this area and work with groups to basically try and understand what we need to do differently better. And so what I'm saying to you today is we come here to actually learn, and there's so much knowledge in this room, so much practice in this room in terms of how we need to mold our practice and change our practice to be appropriate for the communities we serve.
We spend a lot of our time on clinical care, like seeing patients and trying to help them, but we also spend a lot of our time in medical education, like teaching residents, teaching fellows, teaching medical students, teaching grad students, and we do some research as well. So we're very, very interested in child health and maternal health, and one of the reasons why is because about 3 to 4% of kids are born with a congenital anomaly, and some are isolated and some may be genetic. And the number one cause of death in infants in Canada is actually congenital anomalies and a group of conditions that are genetic that are called chromosomal disorders. So it's an actually really important public health topic and relevant to children's health.
We call this a portable ultrasound, and it just connects to either a phone or tablet. But what's special about this probe is it has the AI ability to be able to detect the hip joint and do all the evaluations we need to determine if the hip is normal or not.
This is another view of the on and off reserve comparison of data. So you can see, well, what you guys know, what's as technicians in your nation, this is what are the needs on reserve. But you might be curious, well, what's happening off reserve? Is it standard across?